In a groundbreaking move, the National Senior Citizen Center (NSCC) and the United Nations Department of Economic and Social Affairs (UNDESA) have joined forces to transform care and support for older persons in Nigeria. In a two-day international workshop held in Abuja, introduced the innovative auxiliary care agency model poised to revolutionize geriatric care in the country. Dr. Omokaro, Director General of NSCC, unveiled the initiative, emphasizing the potential to bring comprehensive support and services to senior citizens nationwide. The domiciliary care model aimed to address significant challenges facing geriatric care in the country.
We are here, the participants, international consultants, the UNDESA, the United Nations Department of Economic and Social Affairs, and all other partners, to put together steps, implementation steps, to operationalize what we already conceptualized, drafted, and gotten approval as national policy guidelines for care quality assurance, care settings, I should say that home is where you get skilled workforce, caregivers, going to wherever the older person is taking care to meet the care. To now get the care, the skilled care, with the care plan, depending on the need, the continuum of care need to meet the older person who needs that care, wherever that person is to now come together, look at our policy documents, look at a strategic roadmap, look at global best practices, and then localize it in Nigeria. It is huge for job creation. The certification. We have brought dignity, professionalism, normality into caregiving. And the beauty of it is that these levels of training have been integrated in the federal government employment scheme, so they can get jobs. So what NSCC is doing is really opening up the geriatric social care subsector.
The Permanent Secretary of the Federal Ministry of Humanitarian Affairs and Poverty Alleviation, Abel Enito, represented by Garba Aganawenga, pledges the ministry unwavering support for NSCC initiatives. Dr. Robert Veni, Senior Social Affairs Officer for UNDESA, commended NSCC for its giant stride in aligning with global best practices, while Dr. Walter Kadaze Molubo, World Health Organization's country representative, stressed the urgency of addressing the needs of older persons, citing the projected 700 million individuals in this category by 2050.
The ministry pledges its unalloyed support of NSCC by undertaking ministerial level advocacy for more funding support.
Should be provided in the way that is most effective and reaches older persons and addresses their needs wherever they are. We know from surveys, and it was mentioned that this is the case obviously also in Nigeria, that it pertains to all countries in the world, that when you ask older persons where would they like to be cared for, the vast majority point out that they would like to be cared for at home by their own family members or by carers who have been trained to perform this kind of job. I think it is important for member states of the United Nations to really give due importance to care at home. And I think the arc is now basically closing with a focus on home care and how that can be provided and how the carers can be assured to pertain or to reach certain standards, minimum standards that are set by the government.
And one of the things that DG has achieved is to reposition geriatric care in Nigeria. The center, the essence of all our discussions is universal coverage. We know the statistic globally, over 700 million persons aged 65 years and over from 2019, with the projections for that number to reach 1.5 billion globally. In Africa, our share was about 30 million, and it's projected to reach 100 million by 2050.
This innovative approach prioritizes independence and quality of life for senior citizens in their own homes, with a collective effort of NSCC UNDESA and the Nigerian government. A new era of sustainable development and comprehensive care for older persons is on the horizon.